If you have a bladder control problem, you are not alone. Incontinence or problems with bladder and bowel control is common following a stroke. Sometimes the signal from the brain to the bladder can fail after a stroke. Up to 80% of stroke survivors experience some incontinence. The good news is that 70% of it is treatable. There are several kinds of urinary incontinence. Let's look at the different types and some of the ways to treat them. One is urge incontinence. When your brain gets a signal that you need to go to the bathroom, you need to go right then and can't stop once you start. Stress incontinence is another common type, when you leak urine when you cough, sneeze, or laugh. There is also overflow incontinence. With this type, you never fully empty your bladder, so you feel like you have to go to the bathroom all the time. Some people, especially people who have had a stroke, may have a harder time getting to the bathroom on time or getting complicated clothing off. They experience what is known as functional incontinence. This isn't about loss of bladder control, but happens when people have trouble walking or have to wait for help to get to the bathroom. Finally, some people have what is called mixed incontinence, with features from more than one of these. The good news is that in most cases, incontinence can be treated or controlled. Don't keep the problem a secret. Talk to your doctor or nurse to help find the best treatment for you. It's important to remember that treatments will vary depending on the type of incontinence. One common treatment is to follow a schedule for using the bathroom. Usually you start this type of program by keeping track for a few days of each time you use the bathroom and of any accidents. A healthcare professional will use this information to develop a bladder retraining program just for you, with fixed times to go to the bathroom to avoid accidents. Similarly, having someone remind you to go to the bathroom at regular intervals, also known as time voiding, can help prevent accidents. For people who have stress incontinence, where leaking can be caused by sneezing, exercising the muscles around the bladder, also called pelvic floor muscles, can help. Ask your healthcare professional about these special exercises called Kegels. Another helpful suggestion is to wear clothing that is easy to get off quickly, like pants with elastic waists. Some people's bladders are irritated by spicy or acidic foods, which can make it more difficult to control their bladders. Some people have to urinate more frequently after drinking coffee or alcohol. Keeping track of how your diet affects you can help in controlling incontinence by cutting back the amount of upsetting foods or beverages. Changing what you drink, how much, and when can all help control incontinence. Incontinence is difficult and can be embarrassing for anyone. However, there are many treatment methods. If lifestyle changes don't control it, there are also medications that may help. Talk to your healthcare professional. Don't let incontinence control your life. Visit www.stroke.org for more information about managing incontinence post-stroke.